Hey there! Today, we're diving into something serious but super important, the secret epidemic of dementia. You've probably heard the word tossed around in conversations about aging or memory loss, maybe even in movies or TV shows. But what exactly is dementia? Why is it suddenly showing up in the news as a growing crisis? And most importantly, what can we do about it? First off, dementia isn't a single disease. It's more like a family name for a group of symptoms that mess with your brain's ability to remember, think, reason, and interact socially. When these symptoms become bad enough to disrupt daily life, that's dementia knocking at the door. Imagine dementia as a giant umbrella. Underneath it, you have different types of dementia. The most famous, or infamous, of these is Alzheimer's disease, accounting for about 60 to 80% of dementia cases worldwide. Alzheimer's is like the big boss, but it's not the only player. There's also vascular dementia, which happens because of problems with blood flow in the brain. Think mini-strokes or clogged vessels. Lewy body dementia, caused by abnormal protein clumps called Lewy bodies. Frontotemporal dementia, affecting the front and sides of the brain, which can mess with behavior and language. And then some rare types, plus cases where people actually have more than one type at the same time, what doctors call mixed dementia. So, dementia is complicated, but that's just the beginning. Here's where things get a bit spooky. Dementia is often called a secret epidemic because it sneaks up on us quietly and often gets mistaken for just normal aging or stress. You know, those classic excuses. Oh, Grandma just forgot where she put her glasses again. That's normal at her age. Or, he's just a little distracted lately. But that's the problem. It isn't always normal. And early recognition? Super important. Catching dementia early can help manage symptoms better, plan for care, and maybe even slow progression. Right now, about 55 million people worldwide live with dementia. And get this, by 2050, that number is expected to triple to 150 million. Aging populations and longer lifespans are big factors. Plus, we're just getting better at diagnosing it. But many healthcare systems aren't quite ready for this tsunami of cases. So it's secret because it's growing quietly and fast and often under-discussed, even though it affects millions of families. Before we go deeper, let's smash a few common myths that confuse and sometimes scare people. Myth number 1. Dementia is just memory loss. Memory loss is definitely a big part of dementia, especially with Alzheimer's. But dementia can affect much more, like your ability to use language, pay attention, solve problems, or even manage your mood and behavior. So it's a whole brain thing, not just forgetting. Myth number 2. Only old people get dementia. Sure, dementia risk shoots up with age, doubling every 5 years after 65. But it's not normal aging. Plus, younger people can get dementia too, called early onset dementia, sometimes in their 40s or 50s. It's rare but very real. Myth number 3. There's nothing you can do about dementia. Not true! While there's no cure yet, a lot can be done to reduce your risk or delay onset. More on that in a bit. Myth number 4. Dementia is caused by Alzheimer's only. Remember, Alzheimer's is the most common, but many other diseases and conditions cause dementia symptoms. Now, let's talk causes. Dementia happens because brain cells get damaged or die. Different diseases target different brain parts and cause different symptoms. In Alzheimer's, abnormal proteins called beta-amyloid plaques and tau tangles build up, damaging neurons and interfering with brain communication. Vascular dementia comes from blood flow problems like mini-strokes or clogged vessels that starve parts of the brain of oxygen. Lewy body dementia is caused by protein clumps called Lewy bodies that disrupt brain function. Sometimes a person has mixed dementia with a combination of these causes. But, and this is crucial, some dementia-like symptoms come from reversible causes, such as vitamin deficiencies like vitamin B12, thyroid problems, infections, or side effects of medications. That's why a proper medical diagnosis is so important, to identify if the dementia symptoms are from something reversible or need specific treatment. Okay, who's more likely to get dementia? Age is the biggest risk factor. Your risk doubles every 5 years after you hit 65. Family history and genetics play a role too. If a parent or sibling has dementia, your risk is higher. Other risk factors include cardiovascular diseases like high blood pressure or high cholesterol, diabetes, smoking, obesity, physical inactivity, poor diet, depression and social isolation, and traumatic brain injuries. Notice a pattern. Any of these are lifestyle related, and they also affect heart health. Spotting dementia early is critical. The early signs can be subtle and easy to miss, such as forgetting recent conversations or events, trouble with familiar tasks like cooking or paying bills, struggling to find the right words or follow conversations, getting lost in places you know well, and mood changes like anxiety, irritability, or withdrawal. If you or a loved one notice these signs, it's time to see a healthcare professional. Early diagnosis opens up more options for management. Here's the hopeful part. While you can't change your genetics or age, about 40% of dementia cases worldwide could be prevented or delayed by addressing modifiable risk factors. The Lancet Commission on Dementia Prevention identified 12 key risk factors to tackle, which are keeping your brain active with education and learning, treating hearing loss. Yes, hearing aids are brain boosters. Controlling hypertension and diabetes, quitting smoking, staying physically active, eating a healthy diet. Think Mediterranean style. Lots of veggies, fish, olive oil. Staying socially engaged, humans need connection. Managing depression, reducing alcohol intake, avoiding air pollution, preventing head injuries, helmet up, and early treatment of any reversible conditions. Basically, everything that's good for your heart is also good for your brain. Now, the tough news, there's no cure for most types of dementia yet, including Alzheimer's. But there are medications that can help ease symptoms or slow things down a bit, like cholinesterase inhibitors and memantine. More importantly, supportive care. Things like cognitive therapy, social support, physical exercise, and creating a safe environment can make a huge difference in quality of life. Researchers are actively working on new treatments, including immunotherapy and drugs targeting those nasty beta-amyloid plaques. The hope is that early diagnosis will make these treatments more effective. Here's where I get a little pharmacist pride going. Pharmacists are on the front lines of dementia care too. We can spot early warning signs during routine visits, help manage medications avoiding interactions or side effects that worsen thinking, educate patients and caregivers on managing the disease, and support adherence to medications and healthy lifestyle changes. We're part of the team helping people live better with dementia. Dementia doesn't just affect the person diagnosed. It impacts families, communities, and entire healthcare systems. Better understanding helps reduce stigma and fear. It encourages people to seek help sooner and supports ongoing research. And knowing that many risk factors are modifiable gives us all hope and a call to action. It's not hopeless, and we can make a difference. Dementia is complex and growing fast, but it's not an inevitable part of aging or a hopeless condition. By recognizing the early signs, supporting brain health through lifestyle choices, and fostering early diagnosis, we can change the story for ourselves and for future generations. Thanks for watching. If you found this video helpful, please subscribe for more pharmacist-backed health insights every Friday at 5 p.m. Mountain Standard Time. Got questions about dementia or brain health? Drop them in the comments. I'd love to hear from you. This is Pharma-Logic, where medicine meets meaning, one smart, brain-healthy video at a time.